I'm going to give you a little sort of run through on the anatomy. It's going to be super short. We're not going to talk about any individual bones. Okay. First of all, what is the difference between long, short, flat, irregular? Bones of the limbs, okay? Bones of the limbs are long with a couple of exceptions. So your humerus, your radius, your ulna, all your metacarpals, all your phalanges are long bones. Even those tiny little phalanges, like the fifth distal phalanx here, it is still considered a long bone because it has a cavity. Does that make sense? That's just it. What are the exceptions? In all four limbs, the exceptions are bones that form either wrist or ankle. So these carpal bones are all short. Tarsal bones are all short, and so is patella. That's it for the short bones. What about flat bones? Your thoracic cage is flat. Okay? Ribs, sternum, flat. Your what's called pectoral girdle, so clavicles, the collarbones, and scapula, the shoulder blades, considered flat bones. The bones of the cranium are flat. Some bones that form cranial floor and facial bones are irregular. So irregular bones are weirdly shaped. For instance, all the bones that form your vertebral column are irregular bones. Hip bones are irregular bones. Okay? Good? Questions on this one? While we are at anatomy, I'm going to throw some ideas. First of all, human skeleton consists of 206 bones. It sounds depressing, but if you think about it, many bones are paired. So in order to memorize them, you need to memorize much less than 100. I'm dead serious. Like, you memorize one arm, you've got both arms right away. Okay, so 8, 5, 14, what is it, 27, 30 bones in the arm. So memorize 30, you actually memorize 60. Does that make sense? And for many bones, like for vertebral column, you need to memorize just 5 different types of vertebrae, and that's it. So it is actually much less than 206, just individually memorizing the bones. Okay? Second thing, in regards to sort of bone function, kind of, you absolutely must know what anatomists call bone features. I have a list of bone features. To what extent? No, you don't need to memorize all the bone features on all the bones. What I'm saying is this. There are projections on the bones, like tubercles here, greater and lesser tubercle. If you see a projection, like a process, like this acromion process, okay? If you see a process, if you see a tubercle, what does that mean? There is a muscle that attaches at that place and pulls the bone. Does that make sense? That's the idea. If you have a projection, this projection is whatever the name of it, crest, line, tubercle, trochanter, process, it's all going to be muscle pulling. Good? If you have a shallow depression like fossa, and fossa, there's intracranial, there's cerebral fossa. It means that some relatively large organ is sitting there. Okay? Like cerebral fossa means brain sits there. Subscapular, no, infraspinous fossa, here, muscle, but still, large organ. So I'm not asking you to memorize what sits in each fossa, but kind of, have an idea. Something is sitting there, something pretty large. Now, last type of features, canals, foraminus, and fissures. So canal, probably there's like a nerve maybe or a blood vessel going into that canal. Make sense? Same goes for fissure. Same goes for foramina. Foramina is opening, like this obturator foramina. A whole bunch of blood vessels, nerves go through this. Okay, does that make sense? Just something is going through at this level. So, like if I ask you, in which of these bone features will most likely accommodate an organ? And ask you, fossa, crest, fissure, or tubercle. And you think, well, organ means something like empty. So fossa works fine. Any questions on this one? Okay.